Good evening, everyone, and thank you for joining us to another session of International Dermatology Education Foundation. Tonight, we're very happy to discuss the art of clear skin, exploring Dermo-Cosmetics as a key player in acne relief. And our guest is globally known Dr. Sonia Abdullah. I'd like to thank to our supporter tonight, which is Othermal Avin. And as you know, International Dermatology Education Foundation is a nonprofit organization that we're putting this program on tonight. However, before we begin, if you have any issues, hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. At the end of this webinar, a survey will pop up in your browser and will be mailed to you within 1 to 2 days. We would greatly appreciate if you could fill out this very short survey. If you're having technical issues or if you would like to submit a question to our faculty, please submit your question in the questions pane on the right-hand side of your screen, and you can do this anytime. However, we will try to answer all those questions at the end as time permits. Also, within 1 to 2 days of the webinar, a certificate of attendance will be emailed to you. So again, please submit your questions using the questions pane on the right-hand side of your screen, and we will try to answer them all at the end of the program as time permits. As I mentioned already, International Dermatology Education Foundation is a nonprofit organization whose principal mission is to raise awareness and improve dermatology care all over the world through education, especially in underserved areas. As you may remember, we have had several programs, several webinars, not only in US, but in North America, as well as globally in South America and Southeast Asia and Europe. And you can see some of our involvements, previous programs here. So tonight, as I mentioned, we will discuss the art of clear skin, exploring Dermo-Cosmetics as a key player in acne relief. Our guest is Dr. Sonia Abdullah. She's double board certified cosmetic and medical dermatologist, and she is practicing on dermatology on Bloor in Toronto. Thank you, Sonia, for joining us. Welcome, and take the floor is yours.
Thank you so much, Leon. It's an absolute pleasure to be here with you this evening. We will be discussing two of my favorite topics, so touching on the management of acne and again, looking at the role of dermocosmetics in particular. So I'm just going to move ahead here. Let's look at the objectives for this evening. So we'll be looking at key concepts in the pathophysiology of acne, looking at key skincare ingredients and the evidence to support their use in both active management and maintenance treatment phases for patients with acne. And lastly, look at the role of dermocosmetics as supportive therapy for our patients using prescription acne treatment. So it's always very interesting when real world events impact the world of dermatology. And we're fortunate that sometimes we do make it to the news. So on the left of your screen, and this was an incident that occurred almost 20 years ago. And this is the former president of the Ukraine, Viktor Yushchenko, who was exposed to dioxin. So dioxin triggering a halogenoderma. He was taken under the care of a French dermatologist, Professor Jean-Hilaire Saurat, and he is the person who's at the bottom left of your screen. So following this particular event and exposure, it spurned additional appetite to investigate comedogenesis, and then Othermal, the Aven Dermatologic Laboratories, supported the research that we will be discussing this evening. So Professor Saurat developed the concept of the comido switch and subsequently led to the development of the skincare product that we will be reviewing this evening. And that product is the Cleanhouse Comedoclastin. So before we go any further, I'm going to put a question to the group. So when making skincare recommendations to patients, do you typically recommend key ingredients, specific products, or perhaps a combination of both? I'll ask you to enter your answer on the poll. And I think there's a lot of different ways that we can approach this. Some will look at guiding patients kind of more globally, some will look to specific products, and it may vary depending on the type of practice that you had, one that's more medically focused or practice that is more medically inclined. And we are seeing that the vast majority will look at both recommendations for key ingredients as well as specific products. Excellent. So I look forward to sharing the rest of this presentation with you this evening. So I'll share with you a first case. And this is a case of an 8-year-old female who comes to your practice with a history of new onset closed comedones to the forehead and chin. She's premenarchal, has a history of sensitive skin, like many patients in this age demographic. There's a relevant family history for acne, and she's accompanied by her parent, her mother, who is looking for an OTC or an over-the-counter skincare recommendation. So keep that in mind as we review some of the data moving forward. Let's look at the discovery and concept behind the Cleanoff Comedoclastin product. When we have patients in front of us in clinical practice, the photo that is shown on your screen, this is the clinical involvement that we can appreciate, but that patients are also very concerned about. When recommending topical treatment and sometimes even systemic therapies, part of the counseling process is to get patients to stick with the plan. Now, this can be challenging for some patients because we often know that there is more acne there than meets the eye. And what we may be seeing at the surface may only represent 0.1%, 10% of the active acne that is underlying the skin. So we are very familiar with this concept, but when we kind of want to dial back, that invisible involvement, that represents the microcomedone load when it comes to acne and the clinical evolution that we will see in patients. So let's go back to that research that Professor Sora developed. So again, key publication looking at the concept of the comido switch. So we're very familiar with the structure of the pilosebaceous unit. But in acne, there is something that happens, a switch that gets flipped that transitions the healthy pilosebaceous unit to the microcomedone. And that is that subclinical acne involvement, that lesion that will eventually evolve into the comedone, the papule, the pustule, and that clinical involvement. I was fortunate to attend the World Congress of Dermatology in Singapore earlier this year, and the concept of the comido switch continues to be very relevant. There's still ongoing research being done in this area, and some of the newer concepts that are being shared are ongoing research looking at RIG1 positive progenitor sebocytes. And these RIG1 positive cells, they ascend the sebaceous gland, and once they reach the level of the isthmus, they undergo some sort of trigger. We don't understand exactly what that trigger is, but those RIG1 positive cells are very important in the pathogenesis of the comido switch. Beyond those RIG1 positive sebocytes or RIG1 positive progenitor cells for sebocytes, we also have to look at markers for cell differentiation. In the healthy pilosebaceous unit, everything is in equilibrium. We're seeing controlled renewal of the intrafollicular epithelium and a constant uniform thickness of the follicular wall. There's a balance between proliferation and differentiation. In that healthy pilosebaceous unit, there's high expression of keratin 75. And keratin 75 is a marker of a differentiated cell. In addition to cell differentiation and keratin 75 expression, we also have to think about sebum. So sebum is normal in this context. It's fluid, it flows regularly, it flows naturally. And what happens in that microcomedone? So this is where the equilibrium becomes unsettled. There is an imbalance between the number of dividing or proliferating cells and those that are eliminated, triggering the so-called follicular plug. So that progressive thickening of the follicular wall, the excessive exfoliation and buildup of dead cells within the lumen of the pilosebaceous unit, and that thickening of sebum. Sebum that becomes kind of more tacky. Its composition is also more pro-inflammatory, which may also lead to dysbiosis from a microbiome perspective. So this next slide is going to just kind of dial down those differences that exist, again, on your left between the healthy follicle, normal keratin 75 or upregulated expression of keratin 75 versus in the microcomedone where we have underexpression of keratin 75. The differences in cell proliferation and buildup within the follicular lumen, and again, the differences in sebum and in that pathogenic microcomedone, the thickening of the sebum, the more pro-inflammatory sebum composition. So Cleanup's Comedocomedone is using a key ingredient known as comedoclastin. Comedoclastin is plant-derived. It's derived from milk thistle. And this particular ingredient, we'll see how it exerts its effect on the pilosebaceous unit. It's really targeting that microcomedone, which is thought to be the tip of the iceberg when we're looking at that kind of underlying acne involvement that has yet to raise its head to the surface, and again, give patients that kind of more active acne involvement that they're familiar with. So how does comedoclastin work? Remember, plant-derived milk thistle extract base. So comedoclastin upregulates keratin 75 expression by more than 15 times. And through that upregulation of keratin 75, we're able to take that microcomedone and shift it back to the healthy pilosebaceous unit. So really able to reestablish the equilibrium, and not only in active clinical involvement, but in that subclinical involvement, the invisible portion of acne, so we can get to the root of the acne and prevent it from evolving. All right, let's see how well everybody was listening. So I'm going to put out a second polling question. So what is comedoclastin's mechanism of action? A, increases microcomedone formation. B, downregulates keratin 75 expression and enhances epidermal proliferation. Or C, arrests microcomedone formation, upregulates keratin 75 expression, and regulates sebum production. So I'll ask you to share your knowledge in terms of what you've learned regarding comedoclastin, plant-derived milk thistle extract derived ingredient in this particular active for treatment of acne. So I'll look forward to seeing how well that message was communicated in terms of the mechanism of action. All right, so we're seeing majority of people bang on arrest microcomido formation, upregulates keratin 75 expression, and also targets sebum production. So excellent. All right, we're going to keep on moving forward. And this is where we're going to look at the clinical data behind Clinon's Comedoclastin. So this is an international study, again, led by Professor Sora, who is the kind of grandfather of everything that we know about the comido switch and the role of the microcomedone in acne pathogenesis. This is an international study, multi-center, with 8 investigative centers in France, Italy, and Poland. Patients with mild to moderate facial acne were recruited, 48 patients in total between the ages of 12 and 35. I'll draw your attention to the majority of patients, majority of whom were under the age of 18, or pardon me, close to the majority, so just under half were under the age of 18, and the majority of which were female. Patients were instructed to apply the Clinon's Comedoclastin as field therapy, so all over the face, BID application. The follow-up touch points in this study were conducted at baseline 1, 4, 6, 9, and 12 months. So long-term follow-up study. This evening we'll be looking at the 6-month follow-up data. So when we're looking at prescription acne studies that have been developed in response to kind of criteria from the FDA and Health Canada, there's certain clinical outcomes that we're used to looking for. So we're used to looking for the number of patients who achieve clear or almost clear after 12 weeks, and typically that's a composite endpoint evaluated in combination with patients who also achieve 2 or more grades of improvement. So that composite endpoint is considered a treatment success. We also see outcomes in terms of percent reduction of inflammatory lesions or non-inflammatory lesions, or absolute reduction in lesion count. What I'm going to share with you next is different than what we typically see in acne studies. This is an outcome looking at microcomedone outcomes, so microcomedone counts, and that was evaluated as a measure of surface to comido. It was a surface to comido score that was calculated at each of these endpoints. So keep in mind, microcomedones are not visible to the naked eye, and I'll share with you in just a moment how that count was actually conducted. So again, remember, these are patients, young patients with mild to moderate acne on the face, and they underwent cyanoacrylate stripping. And so you'll see on this graph, these are the microcomedone scores that trended downwards over a 6-month period with statistically significant improvement at the 4-month mark. So let's look here at these immunofluorescence images. So on your left, that is a baseline photo. Each one of those red speckles represents a microcomedone at baseline. The follow-up photo on your right, where many of those speckles have essentially disappeared. So that is the absolute reduction in number of comedones over time. So again, remember, microcomedone, that is that acne load, that subclinical acne load that is waiting to unmask itself. And so the Clinon's Comedoclastin directly targeting microcomedone count over a period of time with consistent BID application. So this is the first time that this particular outcome has been used, and the first time that we have a product, particularly in the skincare space, that has been able to address this need. And so now we're shifting into outcomes that we are more familiar with. And this is a global evaluation of acne score. So over a period of 6 months, at the 6-month mark, 85% of patients had a global evaluation of acne score of 2 or less after using Comedoclastin as active and maintenance treatment. Again, BID application throughout the study. And that score of 2 is representative of mild residual acne. So over that 6-month period, majority of patients in the study achieving that endpoint. These are some representative photos from that specific study. So again, early improvement in terms of clinical improvement for patients, that's what most of my patients are looking for. And I think for many of our patients using topical treatments, whether it's in the skincare space or prescription space, it's really important to emphasize that the degree of improvement they are looking for, so objective clinical improvement, doesn't happen overnight. But when we do see products in the skincare space that are able to give early objective improvement, particularly as early as 4 weeks, that is encouraging for patients. So again, the baseline photo on your left and a 4-week follow-up photo on your right of a female patient in this study. And this is a male patient, again, representative example for baseline and 4-week follow-up photos. So acne involvement of the face along the jawline extending into the neck. And this is a longer follow-up time point. So this is a representative photo before and after baseline and 12-week follow-up of a patient. Darker photo type, so Fitzpatrick skin type 4, baseline and 12-week follow-up. And you can see the comedonal load, likely many microcomedones under the surface of the skin in this specific patient. So PROs, or patient-reported outcomes, are also very important because ultimately, our patients, we want them to be satisfied with the treatment. So this was the subject's self-assessment related to improvement. And on the left of your screen, you'll see follow-up scores for self-assessment in terms of improvement at 1 month, and on your right at 6 months. And so vast majority felt that they were improved early on, but when we look at those who were much improved and very much improved, it's close to 50% of patients in this particular study at the 6-month mark. Tolerability can always be a challenge, whether, again, we're using skincare treatment options for acne or prescription treatments. Tolerability can be a challenge because many of our active ingredients do require formulations that have a hydroalcoholic base or a pH that is more acidic. So here we're looking at very, very high levels of tolerability with 96% of patients, or close to 96% of patients, that graded the tolerability of the product as excellent at the 6-month mark. So again, this particular data that was presented this evening ties back to the Aven Klinos Comido. And Klinos really is an umbrella within the Aven line that refers to the acne products. And Comedoclastin is the hallmark topical product that's used for acne in young patients, in adult patients, or in patients with sensitive skin, given its efficacy and tolerability. So we saw over time clinical improvement in acne with BID application and reduction of microcomedone count with ongoing improvement with maintenance therapy. So no reaccumulation of those microcomedones in the background with consistent use. High tolerability levels and high levels of patient satisfaction. So something to keep in mind when we're looking at our patients who may benefit from topical therapy, either as adjunctive treatment for prescription treatment or as monotherapy. Many of my patients like systems when we're looking at topical treatments for acne. And I'll draw your attention to a partner product, which is the Aven Cleanots Cleansing Gel. So this is a soap-free cleanser at physiologic pH that can be used on the face, on the body. It also contains 0.7% Comedoclastin as well as 0.1% zinc gluconate. So key ingredients that can be used to address acne in its active state, but also for maintenance therapy. I'll draw your attention to the concentration of the eau thermale, the Aven thermal water. So 60% of this particular product is made of the Aven eau thermale thermal water. And the thermal water from Aven is well known for its soothing, anti-inflammatory and anti-irritating properties. So again, giving patients that benefit. So we're now going to shift gears into the secondary portion of the presentation, and I'd like to share with you a second case. And I see this type of case not infrequently in my practice. 25-year-old male patient, swimmer. He came in with inflammatory acne on the face and trunk. We opted to treat him with a prescription retinoid as field therapy all over the face and trunk before bed, in combination with a benzoyl peroxide wash in the shower, as well as the tetracycline antibiotic. He comes to see me in follow-up. His acne is better. He's satisfied from that perspective, but still struggling with the maintenance therapy, particularly as he struggles with the side effect profile or the dryness from his maintenance treatment options. And this is where we're going to shift into adjunctive therapies for our prescription acne treatments. And again, remember, we're in the Cleanots family, and now we're going to shift from Comedocomedone, and we're going to shift over to the Hydra line. So Hydra is meant to be a complement to drying or irritating acne therapies, quite frankly. And there are key ingredients in the Hydra line. And so we'll break them up into glycoliol and dextran sulfate. And I'm going to take you through these in just a moment. So glycoliol, this is a proprietary ingredient, and it is a prodrug that is meant to act as a skin reservoir to replenish skin barrier function and also to address hydration. Glycoliol is made up of the two parts, linoleic acid and glycerol. Linoleic acid is a key component of our skin barrier. So it's meant to act as that cement or that mortar between the little bricks in the stratum corneum. It's a free fatty acid. It's the key component of ceramides. And again, it contributes to the integrity of the stratum corneum and skin barrier function. So we have linoleic acid as one component of glycoliol, and the other component is glycerol. So glycerol is making its place in the skincare world, but it's also an ingredient that we're seeing in hyaluronic acid injectables. So in the world of microdroplet hyaluronic acid, glycerol is now being added to the hyaluronic acid preparations, again, to boost the hydration effect. So we are also able to use glycerol topically to act as an intense physiologic hydrator. It's already naturally present in the epidermis, particularly at the level of the stratum corneum, and very hydrophilic and hygroscopic. Its presence is favored in the lamellar layers of our skin barrier, and that's really where hydration is maintained. So key ingredients in Cleanots: Hydra, glycoliol that is composed of linoleic acid and glycerol. Here we're looking at, again, just outcomes related to skin dryness following 1 week of BID application of glycoliol. And after that 1 week of BID application, significant reduction in skin dryness, a reduction of 93% in this particular study. So again, something to keep in mind in terms of its mechanism of action. So remember, what glycoliol is that hydrolipid precursor meant to act as a reservoir at the level of the skin barrier to restore its function, and again act as a reservoir for skin barrier function. And so flipping into dextran sulfate, remember glycoliol, dextran sulfate. So what's the role of dextran sulfate? So this is an anti-inflammatory ingredient, and the pathway through which it works is through prostaglandin inhibition. So prostaglandin inhibition that drive inflammation in some of these kind of dry, irritating contexts. In addition to prostaglandin inhibition, dextran sulfate also again induces keratinocyte differentiation and upregulates antimicrobial peptides. So not only having an anti-inflammatory effect, but also reinforcing natural defenses of our skin barrier function. This is a study looking at the at 3 key outcomes in response to the Cleanots Hydra moisturizer. So 42 patients between the ages of 13 and 27 on acne therapies, typically acne therapies known to have a side effect profile that can trigger dryness, such as oral isotretinoin, topical retinoids, benzoyl peroxide in fixed dose, benzoyl peroxide and adapalene. So also topical therapies that may trigger irritation or dryness as well. Patients in this specific study were instructed to add Cleanots Hydra moisturizer to their therapeutic regimen, and outcomes such as erythema, desquamation, and dry skin were evaluated. And you'll see in the bar graphs on your screen, to the far left, we have outcomes for erythema in light blue, day 1, in medium blue, day 8, and in darkest blue, day 29 or 4-week follow-up. And so at baseline, levels of erythema, desquamation, and dry skin that were elevated, and each of those outcomes did improve as early as 1 week out, with significant improvements in desquamation and dry skin, close to 0 at the 4-week mark, and significant reduction in erythema in response to the moisturizer application in conjunction with the prescription therapies. So this is the Cleanots Hydra cleansing cream, and the breakdown of the different ingredients in this specific cleanser. So again, cleansers, moisturizers, they go together. Right hand, left hand, they are like a marriage. And so when making recommendations to patients, I do like to guide them in this department. And again, these are the key ingredients in the Cleanots Hydra cleanser. So the glycoliol at 0.1%, as well as dextran sulfate for skin barrier replenishment. The cleanser does contain a 6% glycerin, which acts as a humectant, again, preserving skin barrier function. And you will see again the Aven Eau Thermale thermal water for its soothing properties and anti-redness properties. In comparison to the cleanser, we have the moisturizer, which also contains those key ingredients, but higher concentration of glycoliol at 2%, same concentration of dextran sulfate, and again, the Aven thermal water base. You'll note here that there is no glycerin in the moisturizer. That's actually an important thing for patients who are acne prone, because in some patients who are more acne prone, that glycerin content can actually be occlusive and drive acne. So not something that we always think about, but I think a key takeaway, especially if patients are using glycerin containing products, it's an important thing for us to keep in mind in terms of guiding them. So again, Cleanout's Hydra, key ingredients, glycoliol, which is the composed of linoleic acid and glycerol, and lastly, dextrin sulfate. So key products that can be recommended for patients undergoing topical therapies or systemic therapies that can trigger dry skin and irritation, ultimately driving compliance and adherence to those prescription treatment regimens. As we wrap up this presentation, one of the challenges that many of my patients with acne tend to struggle with is the area of sun protection. So many of these patients are avoidant of sun protection because of the fear of comedogenicity, the fear of looking shiny or greasy. And so I'd like to take this opportunity to highlight the two different sun care categories that you may consider for patients undergoing treatment for acne. So for patients with oily or acne-prone skin, these are patients that you'll want to direct towards the Aven SPF 50 Plus emulsion. So this is the one that comes in the tube, the orange tube. It's lightweight, not greasy. It absorbs quickly into the skin. It contains monolaurin, which is a sebum regulator. So something to be considered for use for patients with acne that can be used in combination with the products that were covered this evening. So the Cleanout Gel Cleanser, as well as the Comedoclastin Field Therapy, and again, photo protection to be used in combination with the Comedoclastin product, and Comedoclastin meant to be used as BID field therapy application. On the flip side, for patients who are on drying or irritating acne medication, who may not necessarily need the monolaurin, this is where we'll direct these patients to the SPF 50 Plus, the mineral sunscreen line, or the tinted mineral sunscreen line. This is where patients benefit from the lightweight texture of the mineral and tinted mineral sunscreens, the coverage options for the tinted sunscreen, and do keep in mind the tinted sunscreen is also available as a compact. For many patients, particularly female patients and some male patients, the compact is actually a very suitable option for reapplication. So again, something to direct patients towards. And the iron oxide in the tinted sunscreen and in the compact, again, key particularly for your patients with darker phototypes who are going to be more prone to hyperpigmentation. And so again, this is the sun care line to be used in combination with the Cleanout's Hydra for your patients who are on more irritating or drying acne therapies. So at this point, I'm going to wrap up with a final polling question. And I will ask you a question similar to what you've seen previously this evening. Moving forward, when making skincare recommendations to patients, I will recommend A, key ingredients, B, specific products, or C, both. And I'm interested in seeing whether or not the results are going to change from when we initially asked the group earlier this evening. So key ingredients, specific products, or a combination of both. Let's wait and see. And again, this is a group that is very, very well informed, and so a slightly higher number of respondents shifting towards both, and again, some focusing on key ingredients and specific products. Excellent. And so I'll wrap up with this final, these key takeaways. So remember tonight, we've touched on acne and that key target for skincare therapeutics, the Microcomedone. Do keep in mind Comedoclastin, milk thistle derived ingredient used in the Cleanots Comido that upregulates keratin 75 expression, shifting that pathogenic microcomedone back to the healthy pilosebaceous unit. In terms of skin barrier therapy, something very important for us to remember when we are using our prescription treatments that can be irritating or drying, again, guiding patients for best treatment outcomes from an adherence perspective. And lastly, our understanding of key skincare ingredients as dermatologists can ultimately help guide patients to therapeutic success. So I'm very happy to wrap up there and look forward to your questions.
Thank you so much, Dr. Abdullah. That was amazing. I learned a lot. And, you know, I cannot believe how much research now is going into to bring these products, even though over-the-counter products, to the market. It's almost like a therapeutic area of prescription medicines.
It's really interesting, and you know, I think there's so many things that are driving this. Some of it is dermatologists and our willingness and need to understand the science behind these products in order to guide patients, but also the skincare space as a whole. Our consumers, our patients they are learning more. They're hungry to learn more, and they look to us to guide them.
Yeah. Well, one question is everybody's mind. When we give prescription products, we always think about the pregnancy and lactation. Now, I know over-the-counter products, there is no category, there is no guidance. How do you feel? Are they safe enough to give our pregnant patients?
So it's a very, very good question. And, you know, pregnancy is a very interesting time for so many female patients, right? The skin barrier responds differently, the skin sensitivity is different. And because of all of these hormonal changes, you know, acne can be something new that patients are dealing with, or they can have a transition of their pre-existing acne. Keep in mind, Avenotermal, this is a partnership with Pierre Fabre laboratories. So there's a lot of science that backs these products. And one of the things that I was really happy to see is the evidence behind the safety of this specific product in pregnancy, in lactation, and in our pediatric population. So from a safety perspective, this can really be a go-to product for patients who are contemplating pregnancy, actively pregnant, or who are breastfeeding.
Great. And how about one interesting question we got is, how do you manage retinoid irritation? You know, we always deal with it. It's a really difficult issue. What are your recommendations?
So this is where, you know, I spend time with patients getting an understanding of what else they're doing at home, because, you know, you'd be surprised what else people are doing, what concoctions they're using, how much scrubbing they're doing of their faces. So I really want to get an understanding of what else is happening in the background, and we got to make an agreement. Let's keep everything straightforward. We're going to keep it simple. So kind of a therapeutic alliance in terms of what else we're going to be using. So I do make a recommendation for cleanser, for moisturizer. And depending on the scenario, I usually do slow start for patients. So field therapy once to twice weekly with either pre-treatment moisturizer, sandwich moisturizer, or moisturizer on top, depending on things like time of year, the patient's willingness to do all these things. And then, you know, over a period of 2 to 4 weeks, increase the frequency of use.
You know, it always comes up. Do you recommend moisturizers first and then the prescription product, or vice versa?
It's a very, very interesting question. And, you know, it is one of the things that I ask myself. There's not a lot of evidence in this space. There's a few prescription therapeutics where I will do pre-treatment moisturizer. Most of the time, unless a patient asks specifically, I will do it post. But, you know, there's a lot of stuff online, and patients want a sandwich. And, you know, if I can feel comfortable with that kind of pre-treatment moisturizer and not changing the efficacy, just slowing down the absorption of the medication, we'll come to an agreement.
Yeah, that's a good agreement. Do you all, now speaking of the managing the retinoid irritation, do you always recommend adjunctive treatment, the moisturizer, the cleanser? I noticed you mentioned that the cleanser and the moisturizer goes hand to hand like a married couple, which I agree. But do you always recommend to your acne patients always a adjunctive treatment?
So I will make specific recommendations. It's also on a case by case scenario, right? Because some patients come in and they are already very in tune, they're very highly educated, and in those circumstances, I will speak ingredients in terms of key things to look for, but then make specific recommendations for what they should be using. And it's not always with prescription therapies. I'm not always looking for a cleanser or a moisturizer with an active ingredient, particularly when I want to prioritize my prescription therapy, get that on board. I will just look for more soothing things, right? Things that are going to improve the tolerability, improve the adherence of my prescription treatment. And then over time, I may tweak things once we get into the maintenance phase.
You know, speaking of that, did you change your treatment protocols or regimens during the pandemic with the maskne?
It's a great question. Yeah, I did make some changes, and maskne was getting a lot of airtime. General media, social media, print media. But one of the most important things to understand with maskne is making sure that we actually have the correct diagnosis, right? It's not
Yeah.
just it may be acne occurring in the masked area, like true acne, but for many of these patients, it's a variant of perioral dermatitis or even a rosacea-like variant. From that kind of constant stimulation of the pilosebaceous unit. So, I think part of it is making sure that we have the right diagnosis, and then from there making the recommendations. Many of my patients did benefit from dialing back on their more irritating skincare products or prescription treatments. I did get patients to shift to certain types of masks, and for some of them, where we could get away with a silk mask underneath a surgical mask or an N95 without taking away the kind of protective benefit of the mask. That was one of the things that some patients did find helpful.
Another interesting question, this I'm sure has multiple different answers. With popular pustular or cystic acne, will you stick topicals or will you try to convince them to add a systemic agent?
Yeah. It's a great question. And, I think there's so many things that are going to come into play when patients are experiencing more inflammatory acne, where there's evidence of scarring, where there's patients with darker phototypes who are experiencing hyperpigmentation. My threshold for sticking to topical therapies alone, I know that I have to put out that fire more quickly. But ultimately, it becomes a discussion with patients, and I'll often present some therapeutic options and try to guide them in a certain direction. But it becomes this conversation, and there's an element of patient autonomy where I think we do have to respect. Part of what we're doing is educating them, and if I see that a patient will benefit from systemic therapy, and I think they should be doing systemic therapy, and they're not quite there yet, I'll send them home with some reading materials and book a follow-up, either a telephone visit or an in-person visit within a short period afterwards to revisit.
So, a final question. Are samples available? And I am sure people from the company, from Aven, who are here know the answer, but you might be able to answer as well.
I can't make any promises, but I'm sure if we ask the right people, we can get some samples into your hands.
Well, that's great, and we're close to 8 o'clock. I thank you so much for this eye-opening lecture and great research presentation that I was so pleasantly surprised, in all honesty. So I thank not only you, but to our supporter, Othermal Aven, and hopefully we'll see you in another program very soon. Again, I think we already did the question. So Thank you so much. And our next program is gonna be on September the 26th with Dr. Adrian Rodriguez. We're gonna discuss the IL-13 and its key role in moderate to severe atopic dermatitis. Thank you, everyone. Have a good night.
Thanks, everyone. Good night.
Thank you, Sonia.
Thanks, Leon. Have a great night.
You too.
Thanks.